you ever been around someone with type 1 diabetes? Most of you probably have, but you didn't even notice unless you saw them checking their blood sugar, giving themselves insulin, or maybe seeing one of their devices. Type 1 diabetes is the second most chronic illness in children behind asthma. So the information that I'm going to share with you today is something that I've experienced and have been navigating for the past 5 years daily. Type 1 diabetes is an important topic to me because my son was diagnosed at 9 years old. It is something we deal with daily, to the ups and downs, which is literally the highs and lows of daily blood sugars. I've been by his side from day one, supporting, guiding, just helping him sometimes get through the day. This is something he'll have to deal with the rest of his life. So any chance I can get to help, I do it, even though he can do most of it on his own. Today I'm going to inform you about type 1 diabetes, which is often referred to as T1D. The first point I'm going to talk about is what it is, signs and symptoms. The second topic I'm going to discuss is the daily care in the life of a diabetic. And the last thing that I want to discuss today with you about is, although there isn't a cure, it can be managed successfully. So let's start with what T1D is. It is an autoimmune disease where the body makes little to no insulin. And according to the CDC, diabetes is a chronic health condition that affects how the body turns food into energy. A person's immune system destroys the cells in the pancreas that make insulin. And diabetes often develops in children and young adults, but it can happen at any age. When the body doesn't make enough insulin, then too much sugar stays in the bloodstream, and over time it can cause serious health problems. Johns Hopkins Department of Medicine states that in the past, type 1 diabetes has been called IDDM, insulin-dependent diabetes mellitus, brittle diabetes, sugar diabetes, and juvenile diabetes. This leads me into signs and symptoms of type 1 diabetes. Symptoms include excessive thirst, frequent urination, excessive hunger, unexplained weight loss, blurred vision, slow healing cuts or sores. These are just some of the symptoms. The symptoms can appear in just a few weeks or months, but when they are present, the symptoms can be severe. The CDC also states that diabetes is the #1 cause of kidney failure, lower limb amputation, and adult blindness. Diabetes is the 8th leading cause of death. So now that you know a little bit about type 1 diabetes, let's look at the daily care in the life of a diabetic. People with type 1 diabetes must check their blood sugars regularly, give themselves insulin, or wear a pump that continually delivers the insulin. So for the checking of the blood sugar part, there are 2 ways they can do this. The first way is with a blood glucose meter, which requires them to poke their finger, apply a small amount of blood to the test strip that's in the meter, and then the meter reads what the actual blood sugar is. So that is the most common and most accurate reading for a diabetic. And the second way to check their blood sugar is to wear a CGM, which is a continuous glucose meter, which it's a device that's inserted into their body, and it continually reads blood sugars and sends those sugar readings to a device or like a receiver that it comes with or something that's compatible with that to get those readings. The device is worn for 10 days and then it's switched out with a new one. So that's the two ways for checking blood sugar. Next is insulin. The insulin is required for T1D for the rest of their life to manage diabetes. Yale Medicine endocrinologist Anika Anem, MD, says having type 1 diabetes means you will use insulin the rest of your life. People with T1D need to take insulin every day to stay alive. Some of the treatment options are patient education, insulin, lifestyle changes, and blood glucose monitoring. There are two ways to receive insulin. Insulin is not in a pill form. One way is injecting themselves or by another person. It can be done by the insulin pen or with a syringe. With guidance from the endocrinologist and the diabetes team, you will get a treatment plan fitting to your individual needs. The second way, yes, for insulin is the pump. The pump can come with tubing, or the newer versions are becoming tubeless. This regimen delivers insulin into the body at a programmable rate as needed for that individual person. This device is changed every 3 days, and it minimizes the number of daily injections that a person has to do. So, given that there isn't a cure for type 1 diabetes, it can be managed successfully with hard work, dedication, taking care of yourself, and using your support systems. As I stated, there is no cure, but unlike many health conditions, diabetes is managed mainly by yourself. Although no one knows how to prevent it, controlling blood sugar levels and certain lifestyle changes can delay or prevent many of the complications that come with this disease. Type 1 diabetes is challenging daily, but with support, you can overcome the obstacles that T1D presents. Some of the supports are like primary care doctors, foot doctors, eye doctors, registered dietitians, your pharmacist. There are many support groups locally as well as online. We use JDRF, which is now called Breakthrough T1D. This is a nonprofit organization. Aaron Kowalski, PhD and CEO of Breakthrough T1D, said that for half a century, their organization has been at the forefront of type 1 diabetes research and advocacy. He said it is an honor to be the CEO at the breakthrough moment as the organization took on a new name, and that more accurately reflects our communities and priorities. He is an adult and scientist living with type 1 diabetes and believes with their new name it will help deepen engagement and support across the entire community as they drive toward curing type 1 diabetes. Type 1 diabetes can lead to many life-altering things if it's not managed. By not taking care of your diabetes, you put yourself at risk of long-term conditions, heart disease, kidney disease, eye problems, nerve problems, foot problems. Taking care of yourself and closely monitoring your blood sugar levels is key to managing and keeping your diabetes under control. Keeping your diabetes under control helps prevent these things from happening. So before I conclude today, I would like to give you a brief summary of what I've discussed with you today. The information that I provided today comes with great knowledge on type 1 diabetes from myself and several esteemed professionals in the diabetes world. To recap, what I've discussed was the first topic of what T1D is. It's an autoimmune disease where the body produces little to no insulin. The second is when I talked about the daily care for a diabetic, from monitoring blood sugars to giving insulin. And the last topic I discussed was that there wasn't a cure, or there isn't a cure, but can be managed successfully. So as we've heard today, type 1 diabetes can affect many people. Fortunately, there are treatment options to help reduce diabetic symptoms and the risk of developing complications. In my case, supporting my son and using all our resources, our support systems, has been extremely helpful for my son in his fight against T1D. My son wears a bracelet that states God is greater than his highs and lows, and I truly believe that God's way of speaking to him through this, because he deals with highs and lows daily with T1D. I know there isn't a cure, but I'm hoping that sharing this information will help raise awareness of type 1 diabetes.